Hello, my name is Sarah New, and today I'm going to demonstrate how to administer a complete bed bath with peri-care followed by oral care and a occupied bed change and then denture care. I have provided privacy for the patient. I have placed a bath in progress sign and adjusted the temperature of the room. So now I'm going to introduce myself. Hello, Mrs. Smith. My name is Sarah. I'm going to be your nurse today. We're going to be doing a bed bath, and then we're going to wash your bottom, change all your linens, and then clean your mouth, and then do denture care. All right, so I've made sure that I have all of my supplies. I've got a bed bath, 2 towels, multiple washcloths, a bath basin, soap, denture cup, toothpaste, toothbrush. This is a padded tongue blade and some sponges. So all my supplies are ready to go. I'm going to go ahead and perform hand hygiene and put on my gloves. I've also reviewed the patient's chart to make sure that there are no restrictions on activity or positions, and I have assessed that we are going to need assistance because my patient is unconscious. So we'll get to that point in just a minute. We're going to go ahead and take this off. If it were clean, we could go ahead and fold it over the chair and reuse it, but it is contaminated, so I'm being careful not to touch my scrubs. So normally we'd put this in a laundry bag, so we're just gonna put that in the laundry bag. Okay, so we're gonna change gloves, and I'm gonna put on the bath blanket. Now, at this point, if the patient were conscious, you could have them just hold the bath blanket, but I need assistance. My lovely assistant's gonna come in. Go ahead and just hold the bath blanket for me. I'm gonna pull that out. Also, before I got started, I should have asked the patient to void their bladder, but again, since they're unconscious, we don't really have to worry about that. But if they were conscious, you would want them to use the restroom or offer them a bedpan. Okay, it's gonna go in the laundry bag. Go ahead and change gloves. And we wanna put a towel under the patient's head. Support their neck, lift up. Okay, all right, and we're gonna go ahead and take off their gown. All right, I'm gonna remove my gloves so I can untie that knot. I'm going to don a new set of gloves. We're just going to pretend I have gloves on. Okay, so I'm going to need my assistant again to hold the bath blanket in place so I can take this off. Actually, I'm going to come over there one more time. Thank you. I'm just going to pull it out the side. Thank you. Okay, changing gloves. Now I'm going to go ahead and put a towel over the chest. we have not put soap in our water yet. I put the water in and I checked it with my inner wrist to make sure it wasn't too warm. And it's perfect, so we're gonna form a mitt. And start with the eyes. So we're gonna go from the inner canthus to the outer canthus. And then same thing, using a different part of the washcloth, inner canthus to outer canthus. You wanna use a different part of the washcloth so that you do not spread bacteria. Okay, so we're gonna go ahead, still not using soapy water. And we're gonna wash the outer face down to the chin, forehead, cheek to chin. Now I wanna go ahead and just kind of lightly wash the nose. Okay. Now I will add soap to my water, and I also have a rinse basin. So now we're gonna do the ears and the chin. Make sure I get the ear, and just get that chin real good. Same thing over here, using the other side of the mitt. Okay, now we're going to rinse. And pat dry everywhere. Okay. Go ahead and expose my patient's right arm. I'm going to remove the towel from the pillow. I'm going to place it lengthwise. Lift up, supporting the joints. Okay. Get my soapy water. And you want to go from distal to proximal using long, smooth strokes. You do this to help circulate that venous blood back to the heart, and using different areas of the washcloth of the mitt each time. Go ahead and rinse now. Okay. Now I'm going to raise the patient's arm supporting the joints and wash the axilla. Rinse the axilla. I'm going to dry everything. And I would offer the client deodorant or powder at this time, whatever their preference is. Okay, so I'm going to go ahead and pull that out. All right, so I want to go ahead and cover that arm up. I've got the towel on the chest. So we're going to pull down the bath blanket to waist level. Okay, I'm going to go ahead and the chest. You just want to do kind of one at a time since we do have a female patient. I'm going to wipe in circular motions using different parts of the mitt, checking for any skin breakdown. You want to go ahead and you would want to lift the breast and go underneath. Okay. Now for the sakes of recording, we're just doing the side closest to us. We're rinsing. Normally you would want to go on the outside and then work your way this way, but we're just doing one side of the body. Okay, so now you want to fold this up, expose the abdomen, get your soapy water. We do have a clean washcloth. You want to change those out. We're just going to go around, down, and make sure I'm washing the umbilicus. Okay, now we want to rinse. Okay, and pat dry. All right, we're gonna go ahead and put this bath blanket over the towel. And we'll just pull that out. At this point, just make sure your towels are still dry and that your water is still warm, that it hasn't gotten cold or dirty. All right, so we're gonna move down to the leg. Expose the leg. want to place a towel lengthwise under the patient's leg, lifting up by supporting the joints. Okay. Again, washing from distal to proximal, from the ankle all the way to the hip. Same reason for improved circulation. Get that venous blood back to the heart. I'm going to make sure you get under the knee real good. Okay, now we're going to rinse. Trying to use separate parts of the mitt every time. Go ahead and pat that dry. Okay, I'm going to pull that down a little bit. Cover this. All right, so now we're going to bend the knee so you can wash the foot. All right, so you bring your basin over to the bed, sit it beside the foot, lift up, place in. You would want to let it soak for a minute, and just using your gloved hand, you want to go ahead and wash it in between the toes. Get it nice and clean. Switch out your basin with your rinse water. Rinse, rinse, rinse. Remove, and then really make sure you dry the foot, get in between the toes, get all that water out of there. Keep your patient covered because you don't want them getting cold. All right, so now we're going to move on to wash the back. And I'm going to need my assistant for that. If the patient were conscious, you could have them scoot over and just roll away from you, but our patient is unconscious, so we're going to roll them over. Okay, so go ahead, grab the joints. Expose the back. You want to put a towel lengthwise underneath the patient. Okay, we're going to use our soapy water. Now we have switched the water. I'm going to change my gloves, and the water is warm again. It's clean and ready to go. And wash in big circular motions to help improve that circulation. And rinsing. Okay, and we'll just dry that off. At this point, I would do a back massage if requested or if needed. Okay, so now we're going to expose the rectal area. I need to check for any fecal matter. If there were some, I would use toilet paper and remove that, but there is not, so we're going to go ahead and wash. And rinse. Okay, now I need to spread the gluteal folds. I still have gloves on. And check for any skin breakdown and just wipe from front to back. Okay, rinse. And now we're going to dry. Okay, so we're going to go ahead and roll our patient back over. Okay. At this point, I need to perform hand hygiene and apply new gloves. I'm just going to go ahead and put them on. Okay, so I'm going to put this bed rail up and position the patient for prenatal care. I've changed new towels, so those are clean. All right, so the patient is female, so we need to put this in a diamond shape. You want 1 point at the side, 1 point down the bottom, 1 point at the head and 1 point at the other side. All the time making sure your patient is covered. Okay, so we're gonna pull this knee up. I'm gonna bend the knee. You're gonna take one of your side flaps, just bring it around, and kind of wrap it around the foot. Okay. Same thing over here. Make sure that foot's flat on the bed. Bring your side point out and around. Okay, so now we have this center point that we can easily lift up. All right, so we have our clean, warm, soapy water, a fresh mitt. We'll expose the patient. You want to wash from the outer to the inner, using your non-dominant hand to spread the labia, and then down the vulva from front to back. Rinse in the same way. Okay, and then from the mons pubis down to the rectum. And we'll dry the patient. Normally we would have had a towel under here that I would have just grabbed and dried. Okay. Reposition the blanket. Okay. All right, so we're going to change gloves. I'm going to lower this just a little bit. Okay, so for oral care, I am going to remove the pillow. Set this here for now. I have changed my gloves. You want to put the patient on their side. Turn their neck towards me. Where's my... Okay, and we're gonna put this under the cheek and put a towel under the head. So I want to assess for any lesions, any sores in the mouth. Everything looks good. So we're going to use a padded tongue blade, but first we're going to check for a gag reflex. If there weren't any gag reflex, we would need to use suction, but there is. So we're going to place this between the teeth. You never want to put your fingers in the mouth because it is a reflex to bite down. So we're going to use our pre-moistened swabs and just clean in the cheek area, changing swabs, clean all surfaces of the teeth, changing swabs. And then we want to do the top of the mouth and the tongue, changing swabs. Now we're going to move this, get a new one, put it on the other side. Now you want to start on this side because all the stuff that you're cleaning is going to drain over here and into the basin. You don't want to clean where you've already cleaned. We have a fresh swab. Do the roof of the mouth, top of the tongue. Change out your swab. Do the cheeks. Change out. And go ahead and get the surfaces of the teeth. Okay, so we're going to go ahead and remove that. Remove our basin. Okay, reposition the patient. Okay, dry the mouth. Everything is good there. All right, so now we need to do an occupied bed change. I'm going to have my assistant help me roll the patient onto their side. All right, so we want to untuck all of this. Just roll it. Up to the patient. Okay, so now we want to fan fold our fitted blanket. You want that to be kind of tucked under the soiled ones. All right, now we have our draw sheet. Okay, and this you always want to make sure is going from shoulder to knee. And again, just tuck up under your soiled sheets there. Tuck that under the mattress. You can ensure it's smooth. You don't want any wrinkles because that could cause some pressure wounds on the skin. Okay, so now we want to roll the patient to the other side. And you just want to inform them that they're going to be rolling over this hump in the middle. And me and my sister are going to switch sides. Roll them this way. So go ahead and remove soiled linens. Be careful not to touch your scrubs. All right. Taking this to laundry. Changing gloves. Pull this nice and taut. All right, then I'm going to pull our draw blanket. Again, nice and tight. Let's go ahead and lay the patient down. All right, so now we want to put our flat sheet right over this. While I still have my assistant, I'm going to have you hold the top sheet so I can pull out that bath blanket. Some wires on this guy. Okay, so we are all covered. I'm gonna take this to the laundry. I'm gonna go ahead and change out my gloves. I'm gonna put the pillowcase and the gown on the client. So got it inside out, so I can just kind of grab the corner and pull it over. Okay. I'll lift the patient. There we go. Okay, so I'm gonna go ahead and expose this arm so we can get their pajamas on. Normally you would not want to snap that other one shut. So you can just kind of fold it right in there. Okay. All right, now we're going to put our top blanket on. Tie that shut. All right, so you want this 4 inches under the cuff at the top so you can fold it over. Making sure it does not hit the floor. Again, that normally would not be hitting the floor, but these are extra long blankets. You want to fold that over the cuff because you don't want any rough edges rubbing on the client's skin. Okay, you pull that down. Tuck both in together, both the top sheet and the top blanket. Form a mitered corner. Pull this up. Tight in there. Okay, and then you want to pull up 3 inches above the toes so that you don't have prolonged plantar flexion. Okay, so the bed is made. We're going to go ahead and remove the client's dentures using a 4x4 gauze. You just kind of wiggle it gently. If it still doesn't really release the suction, you're going to push down on the gums and then they'll release. We have put a towel in our sink, so in case we drop the dentures, they do not break. Just going to place a little bit of toothpaste on the toothbrush and just brush them like you normally would. Getting all surfaces and rinsing in cold water, placing back in, same thing. Rinse with cold water. Warm water would damage them, and we don't want to do that because they are expensive. Okay, so now that we are done, we are going to go ahead and clean everything up. Take all of this to laundry. Go ahead and return this back to the bedside where the patient can reach it. Remove gloves and perform hand hygiene, and that is it.